In this episode, I talked to Dr. Daniella Vansteenkiste of VSK Veterinary Neurology. We looked at neurology, the importance of a thorough and focused physical examination when investigating for possible pain and dysfunction, and we looked at pain physiology in a way that will help you as an owner to get the help your horse needs. Dr. Daniella Vansteenkiste is a board-certified veterinary neurologist with a lifelong passion for horses. With a strong international background, she offers expert consultations in equine neurology to support owners, veterinarians, and trainers seeking answers to complex neurological cases. Dr. V earned her veterinary degree from the Royal Veterinary College in London in 2014, same place as me, actually. She then completed a small animal rotating internship at Garden State Veterinary Specialists in New Jersey, followed by a research fellowship at the University of Missouri. She completed her neurology and neurosurgery residency at the Ohio State University, where she also earned a master's degree. Her thesis focused on cervical spondylomyelopathy, CSM, also known as Wobbler's syndrome. Dr. V also completed her neurosurgery certificate and continues to invest time in learning new surgical techniques. Dr. V sees small animal patients at Metropolitan Veterinary Associates in Norristown, Pennsylvania, where she sees a wide array of patients with both medical and neurosurgical problems. She is starting up a consulting service that she tells us more about in the episode itself, called VSK Veterinary Neurology, and you can find the link to this in the show notes. This was a great conversation, and the aim was for it to be of clear, practical benefit to listeners, which I think we achieved, and I'm sure you'll enjoy it. Hi there, I'm Lily. Welcome to the Vital Horse podcast. I'm a veterinary surgeon passionate about what our animals' behaviour can alert us to. I focus on nurturing the innate nature of animals to address the deep roots of health, well-being, and vitality. Our relationship with our horses is an inextricable part of this. I am guided by what they show me. Many people say, if only they could talk, but they can tell us so much and we can communicate back. This podcast is about you being able to help your horse fully by finding out what's going on, deciding how best to help, and then doing this ethically and effectively. In this way, we can investigate and treat behavioural signs and underlying health problems, pain, or dysfunction in our horses while actually improving our relationship with them. Let's find out how. Okay, so Daniella, welcome to the Vital Horse podcast. I'm glad you could be here.
Thank you so much for having me.
Yeah, I'm excited about this conversation because when you contacted me, you said, so the phrasing where you said that we would likely have a really good conversation is that you're passionate about combining species appropriate care, good horsemanship, and appropriate biomechanics to help achieve happy and healthy horses. I was like, oh my God, me too.
There's just so many approaches to it, isn't it?
Yes, exactly that. So I guess because because this is really my thing too, it'd be really good to talk through those things in order, and then your specialism is neurology. So then we have a conversation about that, and also about recognizing pain. And I think it will probably give some really helpful practical tips for people if people are going through an investigative process with their horse, thinking that there's something not quite right or there might be pain there. I think this is going to be really helpful for people.
Yeah, I hope we can integrate both the sort of examination as well as like the day-to-day observations.
Yeah, and that's a good segue into the species appropriate care actually, because part of what I've found with providing a species appropriate lifestyle is that you can actually notice a lot more than if a horse is maybe confined a lot, maybe not interacting with other horses very much, maybe maybe not foraging as such, So yeah, I'd be interested to hear your thoughts on that, the species appropriate care side of things.
Yeah, I always go back to the Friends, Freedom, and Forage, and I think that's, been out there on social media quite a bit, but there are definitely like different levels to that. And I think what I like to talk about is just that everybody's situation is slightly different. And I think we get sort of tunnel visioned into like, well, I can't do this perfectly, or, this aspect I can't do. And especially coming from the performance side, like, it can be a challenge to balance all of these things, but just really thinking about like how can I make things better, like even if they don't have access to a ton of turnout, like can I turn them out overnight so they get longer turnout. So yeah, I think in getting these horses moving is a huge part of species appropriate care. Like these horses were not designed to be in stalls. And that can be a challenge, with space and, depending on what your barn looks like. But um, getting these horses moving, having some sort of like social structure, and then really trying to focus on their diet as well, is just so important. And I've been through it where I've had to like change barns because they're closing down or things. And, it is really quite remarkable, like how much these horses just rely on routine and their social structure and their herd and the environment to really be happy and, comfortable in themselves. And I just feel like that's really important to achieve before we go on to like the next steps.
Yeah, absolutely. And they have this whole rich emotional life outside of the period of time that we are actually interacting with them.
Hmm.
I think that that's so important with their friendships, actually. There was a period of time where I was moving my elderly horse Bo. I moved him through various different yards a lot in one period of time for various different reasons. And yeah, I could see each time, he'd started to make some friends and have kind of a secure base of support around him. And then we'd have to uproot him again. And I think sometimes that's quite easy to forget because it's so routine for horses to kind of be moved around and maybe be away for a few days for competing or something like that. And yeah, various behaviors or physiological states, I suppose, could even be caused by their their internal state as a result of those things, and not something more um, mechanistic, I guess is the word.
Yeah. Yeah, I think just like routine for them is so important, as well. And just, I feel like if you have a good baseline, then it becomes easier for them to, you know, experience some degree of stress, whether it is for a few days at a horse show or, just being away from their herd and then they can sort of come back to baseline, a lot easier and a lot better than a horse that's chronically stressed. And I think chronic stress plays into a lot about what we're going to talk about.
Yes, absolutely. Yeah, building their capacity to absorb some stressors for periods of time because they have this stable base. I think that's really important. Yeah. And also, really important is your point about the practicalities of providing the species appropriate care, because, like you say, we don't want to um, make perfect the enemy of good. And then
Right.
I can't provide 100% ideal, so sort of almost stop there or feel completely overwhelmed. And it is difficult sometimes in some setups
Hmm.
to change the management even a little bit. Actually, there's a good example of, say, for example, taking a horse barefoot may not always be appropriate in the
Hmm.
setup that you have now, or you may not be able to change all aspects of your horse's current diet, for example, but you can make some changes. Or, like you say, you might not be able to completely move away from confinement at any stage of the day, but you could increase the amount where they are less confined.
Yes. Yeah, exactly. And I think just like, a lot of people get stuck exactly you said, like perfect's the enemy of good, because they can't provide exactly what they would deem to be ideal. But even just small changes can make a really big difference for these horses. So, yeah.
And also, I think that we do need to have the conversation that why is it normalized that it is difficult to make larger management changes? Because really, we should be asking the question of the ethics of having those stricter kind of management rules in place that are not so horse focused. Now that we know, we have the knowledge that
Mhm.
that they have these needs, and so I don't know really how justifiable it is always for the management rules to be as rigid as they are. So I think we do
Yeah.
need to be, as professionals and as owners, we do need to be pushing for that to whole system to be a bit more horse focused as well.
Yeah, I think some of it's convenience as
Uh,
well. Like, of course, it's way easier to fence a acre field of grass than it is to create some sort of track system or but even like just talking very simply, like put the water in the opposite corner of your
yeah,
feeding or, your shelter or whatever it is. Like there are some very simple things we can do to encourage movement. But it is very exciting to see these facilities that are now being built for horses
yeah,
rather than just using the land as is. For horses. There's a lot of really neat stuff going in there, and you've got a beautiful facility that is supporting all of these important needs.
yeah, absolutely. Yeah, it's so positive that there's a big increase now in facilities that are really horse focused.
Yeah, for sure. We're definitely behind in the States, but I think very slowly, hopefully,
Do
things will
you
start to
think?
change. I do. Yeah. Yeah. I mean, especially I think more so probably at the performance side of things, but I think although some areas have more land, I think we're probably not using it to the best of our abilities always.
Yeah, yeah. Because for me, I guess because I've actually done quite a lot of my training um, in the States because it's
Mhm.
not offered in the UK currently. But yeah,
Yeah.
I guess I see what you mean in terms of large barns with large numbers of horses and small areas of land. So yeah, you just have a
Yeah.
very practical problem of a
I
lack of
think
space.
Yeah. The other thing, I'm in Pennsylvania and we really truly experience all four seasons. And so the winter can be extremely challenging. And the summer can presents with its own set of challenges, but to have some sort of consistent movement all year round for these horses can be really challenging depending on your setup.
Yeah, absolutely. I found that with my track system that the winter time they do move less because I have to close off sections of the track, but it is infinitely preferable to a 12 by 12 foot stable.
Absolutely. Absolutely.
So there
Yeah.
it's not perfect, but it's still good.
Yes, exactly, exactly. And I think that's just where the conversation starts. Like that's, again, just helping people trying to make small changes that can make an impact long term.
Yeah, and like you say with the paddock setup, maybe have the water in the opposite corner to the hay, for example. You can even do that if your horse is currently on box rest or needing to be confined for some reason for some hours of the day. You could have more than one hay net, for example.
Hmm.
So that obviously isn't going to create a huge amount of walking, but it will create some interest. And things like variable feeding heights is really helpful on the postural side of things, they chew differently with their head at different heights, so you can start to get dental wear patterns that become entrenched if they only ever eat at the same height, and that's particularly important if, say, for example, they stand with their head in one corner of a stable that slopes in a particular direction, and then they'll even be standing on a slope habitually
Yeah.
many hours a day and chewing. So it's a repetitive movement that is, well, we'll get into this in a minute, but it's also being registered by the nervous system as well as being controlled by the nervous system. And so, um, it in the end, the input is almost a bit, it becomes a bit skewed So then their output in terms of their posture might be a bit skewed. You can have asymmetries and restrictions in their body and all sorts of things. So just varying, maybe put more hang rings for nets in the stable.
Hmm.
They're in a different place. They're not always standing in exactly the same place.
Yeah, no, I love that because, again, it's like habit, right? Like you throw the hay through the window and it lands where it lands, and it's probably the same place it lands all the time. So, little changes can surmount to bigger postural and behavioral changes.
Yeah, yeah, exactly. So this might be a good point actually to talk about. So the neurological side of things, because this is actually in my journey of realizing that as a general practice vet, I really didn't feel equipped to get to the root causes of what was going on for a lot of my patients, and I was becoming that felt quite frustrating because I was attending to my patient thinking, I think I'm just scratching the surface here and maybe alleviating some symptoms sometimes. Maybe sometimes I'm getting to the bottom of it, but it felt more like putting out loads of fires that were still smoldering and they
Yes.
might come up again. So uh, I thought that this was kind of a neglected body system, to be honest.
Yes.
It wouldn't feature that highly on my list if I went to look at a patient before I became more aware of how much it might be factoring into various things. So, I guess the first thing to talk about is what does it mean for a horse to be showing neurological signs or that there might be a problem related to the nervous system? And perhaps do we, as professionals, do we really examine the nervous system enough?
Yes. No, that's a great question. So, I will just preface this saying that, like, I think my background in small animal really helped me translate it to the large animal side of things because a lot of the neurologic exam is observation. And that's observation in their normal environment. That's observation moving out in the pasture, moving on a lunge line, moving under saddle. Like there are a lot of aspects to the neurologic exam that I think we miss. And actually, I think that's where owners become very helpful because they see their horses day in and day out. So I always start off with the neurologic exam of observing my patients. And it's really important not to interfere because as soon as you start to interfere, a lot of horses like behaviors and posture and patterns can change very quickly. So I think observation is like a big one, looking, we call it mentation. So is your horse bright and happy and alert? Is it quiet? Is it dull? Is it sort of like hanging out on his own in the herd, or is it partaking in grooming activities and being with its friends. But yeah, mentation I think is like a big category, and that can help us from a emotional well-being, but also from like a um, mental well-being as well. And then, you know, the neurologic exam is going to also involve some degree of, hands-on exam as well. So, the like in terms of after the observation of their mental status or emotional status or however you want to call it, um, I will usually do a hands-on exam before I do a more like thorough gait exam. So palpating the horse, palpating, their head and face, as well as their neck and their spine. And we can assess what we call the cranial nerves. So, like, can they see? Like, can they, feel? Like, can they blink when I like touch their face? when you tickle their ear, those kinds of things, like looking for, are they holding their head to one side? Does their head tilt to one side? And I think that's something that's sometimes misunderstood as a head turn versus a head tilt. So they can hold their heads to one side or they can sort of tilt to one side. Um, but assessing all of these cranial nerves can be helpful to sort of determine whether we've got a problem going on with the brain. And then obviously your sort of body examination is going to help you determine, do we have a problem in the neck, like the upper neck, lower neck? Do we have a problem in their back? And when we talk about their back, we sort of talk about like two different areas. One is going to be your thoracolumbar. So that's sort of like the rib cage area. And then we talk about like the lumbosacral area, which is going to be sort of your lower back, and where the tail meets the lower lumbar spine. Um, so those are things that, are a good place to start. Obviously, we might see some more obvious things, like abnormal wear of the toes. Sometimes we can see like atypical sores like on their heels, like if they're overreaching, are they always overreaching with the same leg? Is it on the inside? Is it on the outside? You see a lot of horses sometimes will have like excessive movement of the tail, like a lot of tail swishing, and that can be like at rest or during movement as well, and can indicate that we've got something going on with our lower back area. Um, you know, these are subtle things. They can progress to really obvious things, like my horse is stumbling and falling on its knees. My horse is like crisscrossing when it's walking. It's not walking on its normal tracks. It's, swaying, which is what we would call like ataxia. But we can also see like things like what we call hypermetria, where sort of the legs are like, the front legs typically will like swing higher than they would. So like an exaggerated movement in any four legs. They can have uneven gaits. And then you get into like sort of the more technical parts of the exam where you start moving these horses, and watching them walk in a straight line and in a circle, very similar to sort of a lameness exam. But I will add that I usually watch them like walk up and down a hill. I watch them back. I watch them figure eight, and those things can be very helpful. I will say that like a lot of the horses I'm looking at have already gone through some sort of lameness exam. So I am a neurologist, and I definitely like to have some, like someone with more like pure limb lameness experience look at these horses too, because unfortunately sometimes we have concurrent issues. And we'll talk about that a little bit later on, I think, but we can see a lot of compensatory patterns for these horses where you may have a foot problem and now we have a neck problem, or vice versa. That's not uncommon. So, yeah, I think a lot of it is observation, some of it is handling, and a lot of it are things that owners can pick up on. And so I think as owners out there with horses that we may not have answers to dysfunction, every little detail may be important. And I think it's up to the veterinarian to sort of tie together the abnormalities that owners are reporting with the physical and neurologic exam.
Yes, exactly that. And so I teach this actually in my attuned assessment approach is to collect as much data of observations as you kind of possibly can. Some of it might not be relevant. Some of it will be very relevant, and to really ask, uh, try to try to do it without attaching meaning as you go along, because then you
Hmm.
to get a bit of tunnel vision and a confirmation bias. So you notice one thing and you think this must mean this, and so then the other things that you notice tie into that. And so then you can end up missing some other signs. But then also to try to not miss certain signs. So, for example, coming back to you talking about mentation, we might think, oh, well, my horse is always like that, or use words like fine. And it
Hmm.
may actually be that there is a change in their level of responsiveness or something like that, maybe in their level of anxiety, and that might be context specific, and that can be really useful information. And the thing about observing them, say, in their environment, like you say, movement can change in different contexts. So sometimes you'll find that you watch them, and if they're at liberty, they do one thing. If they're wearing a halter, they do another thing. If they're wearing a halter plus they're on a line connected to a person, they do something else.
Yes.
Yeah.
Yes.
So it's
Yeah.
important to gather as much of that information as possible.
Yeah. And I think for ridden horses, making sure that we're examining with tack, with and without rider, is very important because I've seen a decent amount of horses that move beautifully on the lunge line, and then you put tack on them, and then all of a sudden there's no forward impulsion. The gait becomes very choppy, the head starts to bob, so there are some, you know, um, abnormalities that we may only detect with a more thorough examination.
Yes, absolutely. And then also the clinical relevance of further investigations that we might do, that always comes back to our physical exam and our observations, really. Plus, I suppose, response to various interventions can help you retrospectively think, oh, well, it must have been this. But if you're finding, say you proceed to do some imaging, and you find changes on imaging, then determining how relevant different changes are on imaging, it all comes back to the observations that you've made of them and your physical exam. So if that's lacking, then it might be quite confusing, the results of
Yeah.
investigation.
Yeah, and that's a great point because we know from just humans, like the MRI abnormalities do not always correlate with where the pain is. And that goes back to sort of some of these compensatory mechanisms. But you can have a disc herniation pressing on a nerve, but you may have muscle pain that is not necessarily tied to the specific area of where that disc herniation is. So I think that's a very important point is that the pain or the abnormalities that we're finding on our exam may not always be exactly correlated to a specific imaging finding.
Yes, yes. Very important because we can go off down a track of um, treatments that then it becomes confusing. Is it that the treatment isn't working, or is it that we haven't actually identified we're not treating the right thing?
Yes,
Yeah,
yes, yeah.
yeah. So I guess it would be really useful actually for people to say what are some signs um, that that your horse might show to localize to the nervous system, and also that bearing in mind that that's very broad, the nervous system,
Yes,
and that it's
yeah.
divided into lots of sort of not really compartments, but it's helpful to divide it up to help our investigative process.
Yeah, for sure. So I'll start off just with a very brief overview of the nervous system. I tend to, in my brain, divide it into the central nervous system, meaning like your brain and your spine, and that obviously includes the spinal cord. And then we have the peripheral nervous system, which is going to be muscles and the nerves that connect the muscles to the spine as well as what we call the junctions between the muscle and the nerve. And so when we're looking at these horses, I will say that generally, like a brain or a spine problem tends to be more obvious than a problem in your peripheral nervous system. And that's the same in small animals as well. But, with a brain problem, like usually you're going to see like abnormal mentation, which we talked about a little bit more. You might see things like circling or head pressing or seizures. Like there are some more very obvious clinical signs that say, hey, I need to look, I'm thinking about a problem in this horse's brain. When it comes to the spine, I think the first thing that I always ask myself is how many legs do I think are affected in this situation? Because if I think that all four legs are affected, that tells me that the problem has to be in front of the shoulder, right? You cannot have a horse that has a problem in the middle of its back that is causing neurologic signs in all four legs. Um, Now, you may have orthopedic disease causing some issues up front and a back problem, but generally, like looking at all four legs, is going to start to tell me that the problem is higher up. If we've got a problem with just the pelvic limbs, then we may have a problem in the thoracolumbar or the lumbosacral spine. Um, and this is sort of getting into the nitty gritty, but like the way that we differentiate different neurologic problems are due to anatomy. So we know that, the spinal cord has sort of two sections. We've got the brachial plexus and then the lumbar plexus, where we have sort of more nerves sort of coming off in those areas. And so you'll see sort of more specific signs associated with that. And I think also looking at like what part of the spine does what in a normal manner. So, for example, like the low back, we're not going to see a lot of like lateral bending there, but we're going to see a lot of like extension and flexion of the spine, whereas we're going to see more lateral bending like through the thoracic spine. So that's where sort of like the normal biomechanics sort of feed into what is then abnormal. But I think, the big ones obviously are always going to be like weakness and what we call ataxia or wobbliness, clumsiness. And those things are going to point more towards a spinal cord problem. Whereas, like, for example, a lameness that's intermittent and you can't block it, then we need to start thinking like outside the box and usually some sort of like, do we have some sort of nerve damage or impingement? But we're now looking like outside the spine because for you, for there to be a spinal cord problem, you would expect it to affect the limbs within that region. It should, they can be worse on one side versus the other, but you are going to have some degree of abnormality in sort of both of those legs generally.
Mm. Yeah, and what about, so in terms of peripheral signs, what about things like the I don't know how to phrase it, the contour and shape of the horse's body, perhaps that might
Mhm.
alert you to something that is of nervous system origin?
Yeah. So for the peripheral nervous system, it's definitely like the more challenging aspect to examine. But I think some of the really obvious ones are going to be muscle atrophy. So if you have a horse that has like a specific muscle that is atrophied, then, that would point towards usually a specific nerve. Now, it doesn't always align beautifully, the puzzle, but usually, like if we've got atrophy at the back part of the leg versus the front part of the leg, then we might be able to sort of say, okay, this is femoral nerve or this is sciatic. You can see specific like nerve, basically the nerves run from the spinal canal or the spinal cord and innervate different muscles. And so if you have particular muscles that are atrophied, it can sort of help you trace back to where the problem is. Um, Muscle problems can sometimes present very differently, like tying up. So if you have like a generalized muscle condition, like PSSM, those types of conditions will be more of like a whole muscular system, like a whole horse abnormality. And then, in terms of like nerves in particular, in small animals, we can do things like reflexes, like assessing their ability to kick and their ability to pull their legs back. And that's just a whole lot harder in horses. But there are some tests that we can do, like just to assess sensation. So this is part of my physical exam, but I'll usually use something like either like a needle cap or what we call a hemostat, but something basically that is like a small area and looking for their ability to like sense it. So it may just be like a little skin twitch or a skin ripple. In some horses, that response can be blunted, and that might be a problem. But in some cases, you may get a very dramatic response, which is usually a sign of, pain and discomfort, and potentially dysfunction. So that might help you as well as your palpation skills, just with your hands, because we're sort of assessing more of the like sensory aspect of the nervous system. And we have both like a sensory component and a motor component, and sometimes differentiating those two can be a challenge.
Mm. Yeah. And I was just going to circle back around as well to the that point about tack affecting their gait, because
Hmm.
there's also a phenomenon whereby say for example you have a saddle that is too narrow in the channel and
Hmm.
pinching spinal nerves. Um, then then you also have the phenomenon where they can then go numb after a period of time.
Yes, yes.
Like a time dimension to these signs as well, which is important. It's important not to just think, oh, it's better now.
Right,
Yeah.
right. Yes, no, absolutely. I think there's some studies on this, that, I think it's about like 20 to 30 minutes that they develop some numbness, from that like chronic compression, or sustained compression.
Yeah. Yeah, so it's important in that will inform on your examination and also maybe the history that whether you're a professional and taking the history or whether you're the owner and giving the history as to whether these things change over the course of a ride to
Hmm.
help to figure out the location and the process going on that's underlying.
Yeah, I think girthiness is a big one in this, like when we're talking about this. Horses that are, challenging to tighten the girth. And then usually like if you either warm them up or, you take the saddle off and put it back on 20 minutes later, then you don't get quite as much of a response. And I don't think that that's necessarily lack of pain, but more so, again, what you're saying, some degree of dulling that
Mm.
discomfort.
Yeah. So this might be a good point actually to go into more of a discussion about pain
Mhm.
because it's really important, one, that we're able to recognize pain and dysfunction. So they they sometimes go together, they sometimes are one or the other.
Yes.
And also kind of when at which stage do we become aware of the pain or the discomfort and therefore are we able to well figure out what's going on and also help. And I think there is probably a fair amount of confusion about pain processes. So yeah, did you want to talk about recognizing pain first from your perspective?
Yeah. Yeah, I think recognizing pain in horses, there's like a lot of work that's being done in this area. There are a lot of different scales that have been published, and Dr. Dyson has done a lot of work in this area with the pain ethogram. So I always refer people back to that because I think that's a really good starting point. She's got like 24 different behaviors that we can look at, and I think a lot of or some of these behaviors, like if you ask a lot of performance riders, they probably would tell you that they're being naughty. And so I think that study is helpful to sort of establish a new understanding of pain in the horse, because there are very willing creatures. And I think they're they're just they want to please. I think the majority of horses are wanting to please, and that can sort of override some of their instincts. Like, if you're being chased by a lion and you're lame, well, you're not going to show that to your predator. So, yeah, I think that is something that can be a very helpful tool. I am very passionate about trying to get horse owners and riders to start to recognize pain, hopefully a little bit earlier, because I think some of these things, pain can be, what we call adaptive, meaning that it is sort of this like acute injury. It's good pain. It keeps you safe. It protects your body. But if that goes on for too long, then it can become maladaptive, where now we've got chronic pain. And that is very different compared to adaptive pain in terms of, treatment and identifying it. And it sort of is a lot more complex. But I think if we could, find pain or, identify pain in horses a little bit quicker, we might not end up with such big issues, because performance issues, I think, are, you know, obviously painful, but I think subtle signs of pain, if we could identify them sooner, then we might not deal with such big performance problems.
Yes, absolutely. That point about the behaviors. So, when horses are perhaps labeled as behavioral, or behaviors are labeled as, evasions, or like you say, like
Hmm.
well, the thing with that is that all behaviors do have a reason behind them.
Hmm.
Um, and yeah, I find that horses, you can tend to believe their response to a situation, and it usually means that they're struggling in some way. So whether they can't carry out something because of dysfunction or because of pain, I think that you can usually believe them. And then also that there's this time dimension to pain as well. So you could have intermittent pain or
Hmm.
context specific. And I think that's sometimes used as a reason to say, well, they were fine for this thing, and now they're not fine for this thing, and they might be fine the next day. So that I think there we probably need to be a bit more discerning about the signs that we're picking up and giving them the benefit of the doubt a bit more.
Yeah, I think if we could just pause on some of these behaviors and maybe just trying to do our due diligence to make sure that there's not something that is the source of that behavior, um, it would go a long way. Like, I think tack is like a really great example in this area, where sometimes changing your tack can really change your horse's behavior in terms of just the process of being tacked up, or, presenting to the mounting block. Like, there are some things that are more simple. Like, it doesn't always involve this like large diagnostic and, process, which I think is scary to a lot of horse owners. And it's a financial investment too. But I think, like, if we could, try and be better at recognizing some of these early signs, then it probably wouldn't lead to some of these, bigger explosions, because the horse is being ignored, really.
Yeah, exactly that. And that's a really important point about adaptive versus maladaptive. And in terms of their posture, you can have a situation. So this is where observing habitual posture can be very enlightening on maybe things that are historic or they could still be going on, because pain often results in a sort of more tension and contraction in their body. And then they can obviously offload painful structures, and then they can overload other non-painful structures at the time, and then those can become satellite problems. So they might now be more the problem than the original
Yes.
problem was. Yeah.
Yeah. It's definitely like a vicious circle, because you have this injury and then, you may or may not pick up on it. Like, maybe it happened in the field, who knows? And then the first signs may just be less activity, and you have inactivity. And then that can lead to secondary pain, because you've now got some sort of abnormal posture or change in your normal patterns, your gait patterns. And so I think some, like again, like some of those early indicators are changes in activity and changes in posture. Horses that are standing like with their legs and like they're on a on a ball, they sometimes will point their front feet, or they stand sort of on a diagonal. But like those things can tell us that something is bothering them. And, obviously, as veterinarians, like we are an important part of the puzzle, but there's so much, there's so many other things that need to be evaluated too, from farrier standpoint, chiropractic, physiotherapy. Like there's just so much there's so many of us that can help if we pick up on these things earlier. And I think we're sort of sometimes like the last case, or the sort of worst case scenario. And so, yeah, I think again, just having, an awareness of what your horse's normal looks like can really help you.
Yeah, and that normal, so sometimes we confuse common with normal because
Hmm.
in domesticated horses, it is common to have various somewhat abnormal postures, sometimes very abnormal postures. And they, yeah, they interfere with things like just recovery because the horse can't rest fully. That's an important part of it.
Yeah.
And I think that there's this real interplay between comfort and then function and structure of the body, where if a horse can't really get comfortable, it's quite difficult for them to restore good function and it can change their structure. So their structure can be
Absolutely.
more damaged, or if you are getting better function, then you get restored structure, more sometimes quickly, but certainly more completely. Um, and yes, and so the the question of something being adaptive at first and then tipping over into maladaptive, it's really important that we catch that so that we
Yes.
can change that process.
Yeah. And like, I think exactly what we're talking about, but like your core stability is really important with a lot of these, abnormal postures, and that can be some of the first things to change. One of the things we haven't really used this word, but we've talked about it, is something called proprioception, which is your body's awareness of where it is in space. And if you're chronically in abnormal postures, it retrains your brain to sort of think like, oh, this is my new normal. And so, helping these horses with, sort of exercises to help improve proprioception can be really helpful to resume a normal baseline too.
Yeah, it can be a really amazing change when you start doing things like that. And also,
Hmm.
it can be really striking how much they were struggling before. And when you do those sorts of things mindfully, you can notice you can notice how much they're struggling. So, say for example, asking a horse to target their feet onto a mat, or maybe to step over a pole slowly. Um, and people might say, "Oh yeah, my horse can do that," and they can go over a row of poles, for example, or they can walk over a mat. But if you really ask the horse to consider, especially with something like if you're doing positive reinforcement training and they're actually targeting to it, so it isn't an
Yeah.
accident that they're going over this thing. They
Hmm.
figure out the concept that they need to place their feet in this location, and you might observe that they can't do that without looking at it really closely, or they always leave one foot behind, or they knock one foot, or that they have to go fast. They use momentum to keep their balance. And
Hmm.
it's real brain training and body training for them to start to retrain that proprioception.
Absolutely. I think one of the things that has also been circulating on social media, but like straddling a pole for the horses. And until I like actually tried it with my horses, I thought, oh, this is going to be easy. And then you go and try, and it's like amazing when you break down a very simple movement, like how much they have to think about it and control their body parts. And you're like, oh, wow, and we're riding in putting weight on their backs and going at speed, but yet we can't control our feet in a very slow and voluntary way of going.
Yeah, absolutely. And their lifestyle plays into that as well, because if they're always on the same terrain or very similar terrain, maybe on the flat, maybe no inclines, maybe no obstacles to negotiate, then then their body is going to find that difficult to negotiate in a sort of
Mm.
a more formal session. So
Yeah,
you can make the environment more enriching and stimulating in that way, and it can help them with their whole body functioning.
for sure.
I think it might also be useful actually to talk about so responding to a horse where we have established they're likely to be painful, that there is a difference between types of pain and
Hmm.
what interventions will do and won't do as well, importantly. So,
Yeah,
for example, medications that you might use to treat known pain or performing a pain trial with a particular medication and what that might tell you, because medications have got a spectrum of action, and then if it's outside of that, then it might not be very helpful. But that might not mean that you don't have pain present. It might mean that you need to try a different approach. And also that there may be several different modalities that we need to use. So, say, for example, just in acute versus chronic pain, because those two are quite different, required
yeah,
approaches.
yeah. Yeah, and pain is really complicated. Like, if you look at it in people, I mean, there are books and books and books. So this is very much a simplification. But I think when we're talking about pain trials in horses, I think one thing that's really important for the horse owner to understand is that inflammatory pain is what we would call adaptive pain, right? It's my body hurts because I cut myself and I'm going to protect that area. Inflammatory pain is going to respond really well to an anti-inflammatory. So whether that's bute or flunixin or banamine, I'm not sure what you guys call it in the UK, but or Equiox or some sort of anti-inflammatory medication, you may see a really positive response to that. But if you have maladaptive pain, and the sort of big category that I jump to mainly because I'm a neurologist, but is going to be neuropathic pain. You're not going to see any improvement on bute or an anti-inflammatory. This is a very different type of pain. And so you're going to need medications that target that specific kind of pain. I think the big ones that we're starting to use more frequently in horses are going to be things like gabapentin. Pregabalin is another one that we use here in the States since it's become generic, but I think that one's still not maybe reached for quite as commonly. But yes, I think in terms of pain trials, we need to be thinking about what kind of pain are we dealing with, because I can't count the number of times that people say, "Oh, it's not pain because it didn't respond to bute," and I think understanding that there are different types of pain that respond to different types of medications is something that's really important.
Yeah, absolutely. And then also, perhaps it might not always be medication either. So, for example,
Yes.
um, something that I think is really under recognized, it's actually becoming a lot more recognized now, is foot pain. Foot dis
Hmm.
even just signs like general, it might be called laziness or just not being very forward. Um, maybe difficulties turning, and certainly difficulties on different terrains.
Yes.
That might not require so much medication as changes to your foot care approach, for example.
Yes.
Or if
Yeah.
you had something higher up in the body, maybe you would need a type of bodywork modality to help with the pain.
Yes. Yes. There are definitely lots of other modalities. Things like shockwave and laser therapy, and there's spectrums for sure, and some types of pain respond better to others. And there's some things that you can do without a diagnosis, and then there's some types of treatments that you really ought to have a diagnosis because not all treatments are benign. But yeah, absolutely. I think there are things that we can do with changing posture, changing, foot, balance, and sometimes also changing lifestyle. Maybe that lifestyle is not going to lead to, an appropriate quality of life for that horse in that particular situation. But changing the lifestyle may be enough to get that horse more comfortable.
Yeah, both in terms of movement and also stress as
Yes, yes.
to deal with pain. And maybe this sounds maybe getting a bit tangled up, but sort of the level of discomfort that a horse feels about discomfort.
Yes, yes. And every horse has a different like threshold at which they're going to start, complaining, right? Like, I think sometimes we are not so good at determining pain, and that's not necessarily our fault, but like some of these horses, like, I think of drafts and cobs, like some of these horses are not quite as sensitive as your thoroughbreds and, your high level performance athletes, and it can be a real challenge. And that's where, again, being aware of these subtle changes that can indicate that there's something amiss.
Yes, I think some horses almost become more compliant when they are in stress or discomfort. So that's a really important thing to catch, because it's all, and that's actually one of the main reasons why I developed my attuned assessment approach, because I was finding that it really helps if a horse goes into being quite stoic or a bit guarded. Then it helps with that. You can notice more subtle signs, and they start to show you more. And then at the other end of the spectrum, if you have a horse that is kind of explosive, and so it's difficult to localize anything, then it's
Hmm.
to temper that somewhat as well.
Yeah, absolutely.
Yeah. Well, thanks. This has been really informative, I think. Um, oh, it's important to ask, how can people find you and the services that you offer to help if people have these kinds of questions in these areas?
Yeah. So I'm on social media, just starting out, but VSK Vet and Neuro, and that's on Instagram. And then my website should be coming soon, which will include maybe in the show notes. But basically, I offer veterinary neurology consulting, and usually talking with clients' veterinarians, just because that makes it a little bit easier to determine like a diagnostic and treatment plan. But I do also offer one-to-one consults with clients, to sort of help people try and get on the right track and have the right conversations with their own veterinarians as well.
Yeah, that sounds great. Yeah. Well, thank you so much.
Thank you so much for having me. I had a great time.
Yeah, me too. Thanks for listening to the Vital Horse podcast, where you can find discussions focused on helping horses in ways that combine scientific principles and evidence with compassion and understanding. Do subscribe if this content has rung true for you. To work with me in a way that honours both head and heart, check out my online and in-person offerings at www.nurturingnatureequine.co.uk. If you are facing problems or are trying to answer questions with your horse, remember that physical, mental, and emotional well-being are inextricably interconnected, that there is a wisdom to nature and to the body that we can assist, and that cultivating meaningful relationships with our animal companions holds an important key to the well-being of all of us. Deep awareness and a compassionate process will enable us to find sustainable, ethical solutions. See you for the next episode, and look forward to working with you too.